I'm the Chief Executive of the Asthma and Respiratory Foundation, and I'm going to be the host for tonight's webinar program. The purpose of tonight's event is to provide practical advice and also answer your questions about your child's asthma. We know that asthma can be difficult to diagnose. It can also be a steep learning curve for those who are living with it, for both parents and children, and it can be a really stressful time for many as well. So our speakers here tonight understand those challenges often firsthand and will share some of their experiences and expertise with you. So let me introduce you now to our wonderful speakers, or our panelists for tonight. So our first presenter is Dr. David McNamara. He is a paediatric respiratory and sleep medicine specialist at Starship Children's Hospital, and the foundation is lucky to also have him as part of our scientific advisory board. And he was the lead author of the New Zealand's Child Asthma Guidelines, which outline best practice for treatment of child asthma. So good evening, David, and could you give us a brief background on your work with child asthma and also why you've chosen that field of medicine?
Thank you. Asthma is exciting to work with. It's a disorder that really affects people's quality of life and limits the things that they can do. And it's just magical to see someone being prescribed the right medication and taking it regularly and being able to participate normally in life and lead a normal full life and play sports and do PE and do all the normal things that kids should do.
Thanks. It must be really rewarding, David, really rewarding. Thank you, David. Our second presenter is Sharon Pihima, and Sharon works for the foundation as our Apiha Takawanga Māori, or Māori community liaison in Tairāwhiti. She is also a mum of 4, and her eldest has had a long, difficult journey with severe asthma. So welcome, Sharon, and would you mind sharing a bit about how asthma has affected your whānau?
Oh, kia ora, Letitia. Thank you for that. And kia ora, everyone. Yep, I'm Sharon. I live in Gisborne. And asthma has been like that uninvited guest in our family that won't leave. Things are a lot better now, but definitely when our eldest, who will soon be 20, when she was a child, it was a really, really difficult journey for us. So keen to sort of share kōrero that might help other whānau in the same situation tonight.
Thanks so much, Sharon. And also now to our third presenter, who is Liam Dulver. Now, Liam has just turned 12 years old and he's a student in Lower Hutt. Liam was the winner of the Child Asthma Award at the Foundation's Respiratory Achievers Award, which were held just in February, just gone. We're so impressed by Liam's maturity in managing his asthma, and also how he's continued to fully live his life and take on sporting and academic challenges, whilst also giving back to the community, which is incredibly important. So thank you for joining us, Liam. And could you tell us a little bit about your asthma journey and what things you've helped or have learned, you've learned about how to manage your asthma better, and also how you keep doing the things that you love to do?
Yeah, thank you. I had asthma really bad when I was young, and apparently I almost died when I was really young. And I've been in hospital a lot of times, and when I come out of hospital, I just try to carry on and just live a normal life. I love sports, especially hockey. It's my favorite. And I just have my preventer every morning and night with my teeth. And when I feel like I'm running out of breath, I take my Ventolin, and yeah.
Thanks so much, Liam, and we look forward to hearing more about your experiences with asthma as well later on. So now I'll explain a little bit about how this webinar is going to work. We want this to be an opportunity for you to ask questions of all of our presenters, and we already have some questions, of course, which have been sent through to the foundation. So you're also welcome to ask questions during this entire webinar. To do this, we'd like you to use the Q&A function, which you should find just at the bottom of your screen. Or the top of your screen. You just need to select the Q&A and type in your question, basically, and I'll keep my eye on the questions, so hopefully we can get through them, as many as we can throughout this session. Before we get into those questions, I think it'd be good to start with David just giving us a quick intro to asthma and what's happening in your child's lungs when they actually have asthma. So if you could just give us a bit of information around that, David.
Cool, thank you. So asthma is a problem of the airways. So the airways start at the throat and branch down into the lungs, and they spread out and branch just like the roots of a tree, and they get smaller and smaller. And in those smaller airways, we get asthma, we get chronic inflammation. So chronic means it's always there, and inflammation means it's a bit inflamed and swollen. And when you have that inflammation, the muscles around the airways sometimes squeeze and narrow the pipes or narrow the airways. So the child always has a bit of inflammation, so it's very important they always have their control of medication. Then every now and again they'll get a virus, or they'll breathe in some smoke or do a bit of exercise, and those irritated muscles, they'll squeeze shut, and that's when you get the wheezing, and that's when you need your reliever medication.
Thanks, David. So it's a good overview and quite good visually to sort of hear how you describe it. So we've got a question that's come through. How do I explain asthma to my child without scaring them? And maybe start with Sharon on that. When, you know, you've had this asthma come into your whānau, how did you sort of manage that without freaking your children out?
Yeah, that is a good question. Our daughter was diagnosed quite young, so I think she was not even 2 years old. But it wasn't kind of until she was sort of 9 when it started getting a lot worse, and we spent a lot more time in hospital. And it wasn't until then when our pediatrician sat us down and he explained it exactly how you did, David. When he described the lungs as a tree and as branches, that was kind of like a light bulb moment for us, that we finally understood just exactly what was happening inside the lungs. And I think that's where it, you know, we need to find really clear, simple, easy to understand explanations for our kids so that we can explain exactly what's going on with asthma when it's playing up. I think it's about giving them information that is not scary, but honest and exactly, you know, so they know what's going on, because we don't want to make things worse and make it more scary, but we want them to have that understanding about what's happening when their asthma is flaring up. Yeah.
Yeah, it's an important balance, I think, between those two things. And Liam, do you remember when you were, you know, the doctor said to you about having asthma and how you felt? Were you scared or reassured by how it was explained?
No, I don't exactly remember, but and obviously I'm not a parent, but I think that you should like make it kind of sound normal, and lots of kids have it, and that there's really good medication for it, and it, yeah. So I don't remember when I was told that.
I think you're right, Liam. I mean, 1 in 8 children have it. So, you know, in a classroom, you're bound to have like 4 kids in one classroom, you know, who are going to have asthma. So very, very common, of course, as well. So this one's for you, David. How do I know when my child's asthma is going downhill and I need to take action?
Yeah, so the first thing is usually it's around a cold or a virus. So it'll start with a runny nose. And the first signs will be your child starts coughing a bit more and is maybe a bit short of breath or wheezy. And then you'll give them their inhaler and you'll notice that they're needing repeated inhalers, or they might not be responding to inhalers. And that's when you really need to get to the doctor for help.
Right, that's a good point. Another good question that comes with that as well, if you are having those asthma attacks, and I'll put this one through to Sharon first, do you have any tips or techniques for staying calm as a parent when dealing with an asthma attack? I mean, when you had that with your daughter early on and they had an asthma attack, how do you stay calm and focused or manage that?
Yeah, I think for us it was, first we had to go and get a really good understanding exactly what asthma was. So we had to go and do a lot of research and learn all the different terminology, learn what was happening, learn how the medications worked, what the difference was between relievers, preventers, steroids, what they were all meant to do, because then it helped us to get an understanding of how it all fit together. Then we went and got a good plan. And I think having a plan is a really important thing as a parent, as a whānau, because you need to know what to do at the different stages. And I think as parents, we can see when our kids are starting to get worse. We know everything about their breathing, the way they cough. We can just tell when things are starting to get worse. And so we need to have a plan in place around what we're going to do there. And then we need to, if things don't improve after we've followed that plan, what's going to happen there, and then through to what's going to happen when it does become an emergency. I think knowing what the plan is definitely helps us to stay calm. And I think getting that help early is probably one of the main things that helps us, not leaving it till the last minute, not kind of going to bed at night and sort of hoping that you'll make it through to the next morning without needing to get to the hospital. I think, if you can get help, the sooner the better. It's a lot easier to get through.
And David, do you have any advice as well for parents to sort of stay calm when dealing with an asthma attack?
Yeah, I'd agree with everything Sharon said. I think having a plan is absolutely crucial, and then reaching out for help. You don't have to do it alone, and you need to, if your child's really unwell, you need to know that you need to call an ambulance, and you need to know how to do that, and really think about getting ambulance membership to make it easy for yourself. The other thing is try and control the asthma rather than the asthma controlling you. That's what I tell kids when I'm talking to them about asthma, and it applies to parents as well. If you have a plan, you can be in control.
And that's a good question probably for you, Liam. Do you have a plan with your asthma and how you manage it?
We do. So if we have, if I start feeling really out of breath and wheezy, then I take my Ventolin and 2 to 6 puff sentences, and if that doesn't help, then doctor. So then call the doctors.
Yeah. So having that plan is really, really important as well from both a parent's perspective and yourself, right? From a child's perspective. This one's for you, David. Why does it take so long to diagnose preschoolers with asthma? I was told my child had preschool wheeze. Isn't that just the same as asthma?
Right. This is actually a slightly tricky topic. So lots and lots of preschoolers get wheezy when they get viruses. It's quite common. And we often use the same medication to treat them because they've got inflammation and the narrowed airways in exactly the same way that you do with asthma. But most of those kids, the wheeze will go away. So usually by the time they're at school, they've stopped having those attacks. So we don't want to label those children as having asthma because it's only going to be a few of them who will stay on and continue to have asthma. And if we say they have asthma when they're 2, that's going to affect them when they're 20, trying to apply for a job or join the Navy or something, or get health insurance. We're just trying to avoid giving them a lifelong label for something that's actually going to go away for at least 2/3 of those kids.
Right. We've actually just had another question or a couple of questions come through online. Here's a good one. First for you, Dave. What's an asthma action plan and how does my child get hold of one?
Sure. So asthma action plan, usually it's a piece of paper or card, and it's got 3 steps on it. How to look after your child's asthma when they're well, how to look after their asthma when they're a little bit unwell, and what to do when they're really unwell, which is usually ringing an ambulance for help or going to hospital. And it tells you how to manage your child's asthma and what to do and how to seek help. And seeking help is a really important part of it. The best way to get an action plan is from your GP or your practice nurse, and they should sit down with you and go through it with you step by step to make sure you understand it, and also to adjust the plan slightly so it suits you, because everybody's a little bit different, and everyone's asthma is a little bit different, and so we all have little variations in what we need our doctor to write on the asthma action plan. And they can also be downloaded from the Asthma and Respiratory Foundation website, which your doctor or nurse will know how to go to and find.
Yeah. Thanks, David. Sharon, have you got any tips for the teenage years, especially around getting your teenager to take their medication regularly?
Oh, the teenage years. But yeah, it's different. It's a different style of parenting when you're a child with a chronic condition like asthma when they're young, and you can make a lot of the decisions and you're having the discussion with the doctor or the pharmacist or whoever, versus when they're kind of at that age like Liam, and then moving into their teenage years where you sort of want to start, well, you need to start handing that over to them so that they can start advocating for themselves, start having those conversations with the people that are looking after them themselves, and you're more there as their support person. It's not easy. Well, it wasn't easy for us, but we got there in the end. And I think it's a lot of, we had to trust our daughter and respect the decisions that she wanted to make about her asthma. It might not have been how my husband and I wanted to do it at the time. We might have done things a little bit differently, but when you're 16, 17, 18, well, that's their decision. It's their body. They want to manage it their way, and you kind of have to trust them and guide them through that process. But I think if you can spend as much time with them, helping them to understand everything, like I said before, and giving them all that information, and finding some really good, like we were lucky, we had a great pediatrician, people that we trusted, that knew our daughter, that built that relationship up with us as a whānau, makes it a lot easier.
That relationship building is just, yeah, so important. Liam, so if you've got a friend in the classroom, you know, who's asking about how to manage their asthma, what tips do you have for helping other kids take responsibility for managing their asthma, because you do it so well with your asthma?
Yeah, for my preventer, for the preventer, I would recommend doing it with like a routine you already do. So like when I do it with my teeth, and now it's part of my routine every morning and that. And for the Ventolin, just kind of like have it every like time. If you get it quite bad, I would recommend doing it before like active events. Like tomorrow I'm going cross country, and I definitely have my Ventolin before that. And during the events, if you're feeling like puffed and wheezy, to have your Ventolin as well. So kind of like know when you need your Ventolin.
Thanks, Liam. And that leads nicely into a question that's come through for David. Can you please explain how Symbicort works compared to Ventolin, particularly when your child is having an attack? Is there a maximum dose they can have before seeking help?
Right, so Symbicort's got two medicines in it. It's got an inhaled steroid, which is a preventer, and it's got a bronchodilator like Ventolin. So when you're taking it, you're getting the benefit of both. And that's really helpful and important for controlling the attack. There's taking lots of Symbicort's safe, but we put an upper limit on it because that's when we want you to seek help. You know, if you're taking lots of puff, that's when you need to get to the doctor or need to go to hospital. And so usually we say if you're needing more than 8 puffs a day of the Symbicort, you desperately need to go to the doctor. And if you're hitting 12, then you really need to be going to hospital. And that the limits for you or your child should be on your action plan that you've worked out with the doctor, so that there'll be a personalized limit there for you particularly, but usually we use about 8 puffs.
Right. And that probably leads well just into a question following that. How do I know if my child's asthma is under control or not under control? Yeah, so there's a series of questions that your doctor should be asking when you see them, and that's usually it's how often in a normal week does your child get a bit of wheeze? How often in a normal week do you need to use your reliever? How often does your child wake in the night with wheezing or cough? And can your child take part in normal activities like sport? And if you're saying that you need to use if your child needs to use their preventer more than twice a week, or they're waking more than once a week, or getting wheeze more than twice a week, or they're unable to take part in activities, then your child's asthma is not under control. And you need to see a doctor because you probably need more preventer or some other treatment, maybe some prednisone for an acute attack. Thanks, David. And Sharon, here's one for you as a parent. What is the most helpful thing a health professional can do to support you and your whānau in managing your child's asthma?
Listen to the whānau. listen to the person, listen to the child, the teenager, and listen to the whānau. That was probably one of the most challenging things through our journey, is that we just weren't getting really listened to a lot of the times. And so we'd sort of deviate away from the plan, or things wouldn't happen the way we wanted them to, or other factors weren't being considered in looking after our daughter. So while, we had a really good team looking after the asthma and the medical side of things, that there's also other things that we needed support with in terms of our whānau, in terms of our other children. And so it's listening to what we really need. Sometimes it's not the asthma, sometimes other things need to be looked after a bit more. But yeah, I think our daughter has always said in her journey, it's about listening to her. Yeah.
And of course, that stress can be a part of being a trigger as well, can't it? So understanding what the stresses are might be important. We've also got a question here. What help can families access when they're looking after a child with severe asthma? David?
Yeah, so there's lots of online resources. The Asthma and Respiratory Foundation's got some really good education resources and videos. There's your practice nurse or GP can give you advice and support, particularly checking your child's using their inhaler correctly, because a lot of people don't, so it's really important to check that. And then locally, there are, all around the country, there are asthma nurse educators or asthma educators, either through the Asthma and Respiratory Foundation or Asthma New Zealand. And if you're having trouble, again, your practice nurse can help put you in contact with that and arrange a referral. And they'll come see you at home, see if there's mold or you need any help with allergies, and they'll check that you're taking your inhaler, or your child's taking their inhaler correctly and regularly.
And we can certainly put up a link or list of all the different societies around as well, because the foundation is happy to promote those nurse educators around the regions. We've had a question come through here. David, how do I work out what my child's triggers are? Are there always triggers involved, or does asthma sometimes just happen without any particular trigger, known trigger?
Almost, not every single time, but almost every time there's a trigger. The most common trigger by far is viruses. So a bit of a runny nose or a cold. Smoke, fumes, dust, exercise, and cold air. So just like Liam, kids playing hockey in cold weather in winter, that's a big trigger, that combination of cold air, dry air, and exercise altogether. But the one that's really easily avoidable is smoke, particularly cigarette smoke, and probably vape fumes as well. Those can be bad triggers.
Thanks, David. Liam, so having asthma and living well with asthma, how do you manage your stress or uncertainty with asthma? How do you manage it if you're getting a bit stressed or worried about it?
It's kind of the same as the first question. Like, I just know that lots of kids have it. I'm not the only one who's going through this, and I just stick to my plan and it will be okay.
Perfect. And as probably same as a parent, Sharon, is it? How do you manage the stress and uncertainty when your kids probably have a different way of managing it? It's probably a unique thing, I guess, for the individual.
Yeah, I mean, it's always been helpful that we're really strong as a whānau, having that whānau support, and we're always able to talk about things as a whānau, everything that's going on with asthma, what's happening with the medications, with the treatment, with the plan. Everybody was on the same page there. In terms of stress, it has been challenging in the past trying to manage work and looking after a chronically ill child. So we had to be really open and honest with our employers about what we were dealing with every day, and that sometimes, work isn't the priority, it's looking after our child. And so having that good relationship with our employers helped definitely. Communicating with the school around what's going on. So we'd have to explain to the teachers why our daughter's away, again with asthma, or getting the schoolwork that she wants, to keep up with schoolwork. It was all of those things that kind of add their little bits of stress. We had to find ways to kind of get through them and then figure out those solutions, so that we could sort of get through this as a whānau.
Thanks, Sharon. David, I've got one that's come through here on the webinar. Is it okay to use a combination of Symbicort and Ventolin? My two sons, 12 and 14, say Symbicort doesn't relieve as well as Ventolin.
Yes, it's okay to do that. Symbicort should work as well as Ventolin. So if it's not, one of the first questions I'd be asking is, are they taking their inhaler correctly? So it's very important that everyone who's got asthma gets their GP or nurse to watch them taking their inhaler, because it's very, very easy to not be sucking hard enough or sharp enough at just the right moment, so that they're not getting enough of the medication. We're trying to encourage people to use just Symbicort rather than Ventolin, because getting both those medications in one go is really helpful for controlling your asthma and preventing the exacerbation coming on and making you feel better. So if I would suggest you get in touch with an asthma educator or your GP or nurse and just check your boys are actually taking those inhalers correctly.
Thanks, David. So a good question for David and Liam as well. Is it safe for my child to play sports with asthma? What do you think, Liam? I'll start with you.
Yes, because it also helps the asthma because all the exercise and being fit, it all helps. So I definitely play a lot of sports, and my asthma is getting better.
And David, I suppose that would be a similar answer from you.
Yeah, I think I'd say almost exactly the same thing Liam said. Taking part in sports and PE is really important for kids' development, as well as their fitness. And just with some simple precautions, on your child's action plan, they should take one puff of your inhaler before you play sports, and that can keep you safe. There may be days you can't, but generally kids should be engaging in sport and taking part in a full normal life.
Thanks, David. A question's come through. Can you please explain exercise-induced asthma? Leading on from that question.
Sure. So when you exercise, you breathe generally slightly cold and dry air deep into your lungs, and that causes some evaporation in the airways. And that just makes the airways a little bit more inflamed and causes the muscles to squeeze shut, so that the airways close up and you get a bit wheezy.
Thanks, David. Sharon, one's come through here. As a parent, do you have any tips for helping your kids to remember to take their medication? And of course, we heard from Liam, is it part of being a routine? Do you have any tips?
Yeah, I think when they were young, it was us as the parents having to do it, and we'd, write down the times and write it on a piece of paper and remember when we needed to do it. This is when they have their asthma's getting worse and you kind of need to step it up a little bit. But other than with the preventers, we just built it into their routine, like how Liam said earlier, when doing it when you brush your teeth, have your preventer first and then brush your teeth and get into that routine and that pattern. And then always making sure they had it in their school bag or they had an inhaler on them close by. And then as they got older, they started putting it on their phones, setting their alarms and their reminders to take their inhalers. But it's just, a combination of everything and a little bit of nagging in there as well, I guess. Yeah.
The joys of being a parent.
Yeah.
All sorts of things. Here's one for you, David. What age do they usually diagnose asthma? I was late diagnosis around 8 or 10, and now they've just given my 3-year-old his first Ventolin inhaler for cough, and doctor said his LLL showing signs of changes. They didn't say the asthma word though. So I guess, when is it usually diagnosed? And it may come back to actually being a difficult diagnosis sometimes with that wheeze, but I'll let you talk about that, David.
Yeah, so we try and, as I said before, we try and avoid diagnosing a preschooler because 2/3 of those kids will get better. And so anytime from 5 or 6, we'd use the label asthma. But you might find some doctors still would call a preschooler asthma. We just try and encourage them not to. So some kids will start as preschoolers and continue through school and their life. Other kids actually won't get wheezy till they get to school age, which is probably what happened to the person who's asking the question. So they tend to be slightly later. And then there's other people actually who don't get asthma until they're adults. So it can come on later as well.
Thanks, David. And this one's come through. Should I get an allergy test for my child if they have asthma? Often things go hand in hand. Should they have an allergy test? Is that recommended in guidelines at the moment, or?
Again, a difficult question. Most kids with allergies, they'll actually be allergic to house dust mites or to grass, things that you can't actually avoid. So we tend not to do allergy testing. If you think it might be a food, that's really important then to definitely get allergy testing, because that's something first you can avoid, but also those kids actually get quite bad asthma. So it's important to know. If your child is in the severe asthma or the chronic asthma group, then we would do allergy testing, because it may be worth investing in house dust mite covers for the child's mattress and pillows, but we don't do it across the board for everyone.
And that leads quite nicely with the next question. Do you grow out of asthma, or does your child, are they going to have it for the rest of their life? That's actually one we get quite a lot. Will I grow out of this asthma? Yeah,
so if they're in that preschool group, then at least 2/3 of them will when they get to school age. There are some kids who seem to grow out of their asthma, and basically the inflammation settles down so much that they don't have symptoms for their 20s and 30s, but then it tends to come back a little bit later, and the inflammation is still there. So people have bad times. Some teenagers have a really rough time, and then when they get older, it settles down. So it feels like they've grown out of it, but it's probably still there a little bit.
Right. We've got another question here that's come through. I use Symbicort, Ventolin, and Bricanyl. I find the Ventolin brings fluid out of my lungs better than the Bricanyl. I have a bit of fluid since COVID as well. I don't know if that's something you've got any advice on, or if that's whether they need to just go and see their GP about, David.
I think check you're using the inhaler correctly. Ventolin may be a little bit better at making you make less mucus in your lungs, but probably all those medicines are the same and actually treating the wheeze, which is what they're there for.
So I think we're...
sorry, can I add to that?
Yeah.
If you've got an ongoing wet-sounding cough, you actually do need to go to your doctor, because you might have chronic bronchitis or some other condition that's not asthma. So one of the big problems we deal with in asthma is there's people have been diagnosed with asthma, and that's not actually the problem. And an ongoing cough is a sign that you might have something else.
Thanks, David. So I think we've had most of those questions. Let's have it. Does my child always need to use a spacer? What's your advice on that, David?
Yes. Children and adults almost always need to use a spacer if they've got one of the MDIs, spray inhalers. There's some people who are really good at it and can get away with it, but we generally recommend it for adults and children to always use a spacer. Otherwise it just goes all over the mouth and doesn't get into the lungs at all.
And I suppose that's all about that, the inhaler technique, and why it's so important to talk to your health professional and your nurse educator and just make sure that that's right and correct, right? Yeah. Another question here. Please explain how parents should look at a child's chest when symptomatic with asthma. Is there anything a parent at home, if there should be?
Sharon, do you want to have a go at that one?
Yeah, sure. Just trying to remember what we used to do. So we learned from our pediatrician what they were looking at when they would look at her chest, and how it moves and what it's meant to look like. We would look at it. That would be sort of one of the things that we do at home as kind of a check. But we would follow through with our plan and the inhalers and getting help if we needed to. Because I was always scared if I just kind of looked at the chest and I made a decision on whether it was okay or not. I didn't want to get that decision wrong. So it was sort of one of those things that we looked at to see if it was, you know, and you can see it. You can see if the breathing is really hard for them. But we would kick in with the action plan and follow through on that.
Yeah. So what you'll see is for little kids, the lower part of their rib cage will start sucking in as they breathe in, and you'll get some sucking in just above the clavicles and the sternum here, the skin drawing in as they breathe. That's a sign they're working harder. And then for older kids, when they're really working hard, you'll actually see the skin sucking in between the ribs and lining out the ribs, and that's a sign they're working hard. But also simpler things like they're just breathing faster and they're using these muscles more. And when they're really bad, they're shrugging with their shoulders. And other things to watch out for are not being able to talk in a full sentence. So if they can only speak 3/4 of a sentence before they have to take a breath, you know they're quite unwell. And if they can only say single words, you know they're really bad. And you really need to be calling that ambulance and get to hospital in a hurry.
Thanks, David. This is one for Liam. Liam, what would your advice be for someone your age who has just been diagnosed with asthma? If you had to say like the top tips and they've just found out they've got asthma.
I would just stick to the plan, like just like all the other Christians, remember you're not the only kid, and don't let it stop you from doing what you want to do. So like I didn't let it stop me from doing sports, and yeah, so yeah.
That's good. So I think we're drawing to a bit of a close here. I really hope everyone's found this really informative and a useful discussion for this World Asthma Day. I'm sorry, hopefully we've managed to answer everyone's questions that have come through, but we will be sending out links to resources, and a video recording of this webinar will be available to attendees later this week. Please feel free to share this with anyone who you think might be interested, if they're a parent or they've got asthma. And if you've got any feedback on the webinar, we'd love to hear from you. So you can email us at marketing@arfnz.org.nz. And just before we go, I want to give our presenters just a final word each, just if they can talk about the key thing that you want people to take away from tonight's session. And if we can have David first.
Thank you. Firstly, apologise for the starring role my dog's taken. So I think the key thing for me is control. We want good control of the asthma symptoms, and as I said before, you want to be controlling your asthma, or your child wants to be controlling their asthma. You don't want the asthma controlling you. And that comes down to taking your preventer regularly and having good inhaler technique and knowing when to seek help.
Thanks, David. And Liam, have you got a final word for peers out there?
Just don't let it stop you from doing what you want to do, and yeah, just stick to your routine and your plan, and you should do it.
Good. And Sharon, have you got a final key sort of points for parents with children who have asthma?
Yeah, definitely a few points actually. One would be the medication is really important. You know, as David said, take the medication how we're being told to take it. And if it's not working, go back and get help. Don't try and sort of tweak things or add things in or try and figure it out yourself, because there are lots of different options that the doctors can do with the medication. And I know for us, once our daughter got on the right medication, she hasn't had a hospital admission in 4 years. And this was going from being in hospital every week. So the medication plays a huge, huge role in it. And then once you've got that control, you do actually start to get better. And I know for a lot of our kids who have chronic asthma, it can be hard to remember what it's like to be able to breathe normally, because it's always there. But you can get to that point where you are living a life where your asthma isn't controlling you. And I think kids with asthma are some of the most resilient kids that are out there, and whānau living with asthma are resilient as well. And I think if we can sort of get that plan happening together, yeah, it will work. And lastly, I just wanted to say, David mentioned earlier about getting an ambulance membership. I would 100% support that, because that's the one thing that helped us at home with getting rid of the fear. Was you knew you could just ring 111 and get an ambulance, and it would come to your home. It would come into your home and give your child the nebulizer, the ReadyPred, whatever they needed. And so that by the time they're getting transported to hospital, they're feeling a lot better already. It gets rid of all of that fear and that racing to hospital and the stress and the panic, just by having that membership. So yeah, those would probably be my main points to take away for whānau.
That's great. Thanks, Sharon. Practical tips as well. So many thanks for that, everybody. And thanks so much for our panelists for giving up their evening tonight to do this webinar. That concludes today's, but as I said, a big thank you to everybody, and kia pai te pō. Bye.
All right, thank you. Bye.
Thank you. Ka kite.